So we're going to start off with by opening all of our bandaging material. Just make sure that we're ready and can get it out easily. It helps if you don't have a dog's nose in the way. When you're opening your dressings, there are lots of different types of dressings. The one I've got is an adhesive, which means that you can stick it directly onto the wound. If you're using a non-adhesive dressing, what we're looking for is the shiny side goes to the skin. So I'm going to show you how to open this in a sterile manner, which means we're not getting the dressing dirty with our fingers. So we're going to open it up and lay it flat like this as much as possible. So in a non-sticky dressing, the shiny side will be up or down. So flip it to whichever way you need. Because this has stuff on the back, we can touch it. So when we open it, we want to grab each side and apply it to her leg, just holding the tabs. So like a big plaster. Perfect. And then sometimes this little piece of paper is really good for holding all your other dressing materials on. So I'm going to try and balance them, and hopefully she's not going to move. Perfect. So then we can get all the rubbish out of the way. So the next thing we want to pick up is you can put so much stuff around the knee. So you can put what's called gamgee, which is just a cotton wool sort of liner. You can wrap cotton wool around it now that the wound's covered. Or what you can use is what we call cohesive bandage, conforming bandage, sorry. And it's just to stretch around and hold anything in place. Now, as I don't have that, I'm just going to pretend that we've got our cotton wool on. So, and she's going to move, good girl. Never work with children or animals. So what we're going to do, how we bandage a knee, we do a band on top and then we figure of 8 around the knee and a band below. So because the knee's a big bulbous, we want to try and make sure that's covered. So I do a nice band around the top, and then we come across and around the bottom and back up and across again. So you can do this as many times as you need to. So, but we'll do this a few more times and just use this up. Because I'm not going to be able to use it afterwards anyway. And then what you can do with your end is just tuck it in, just so that you don't have to hold it. And then we want to put our vet wrap over the top. Now this is really good stuff, but what it can do is it stretches quite a lot and it can be quite tight. So we want to make sure we're not doing that too much. And the easiest way is to stretch it out and release it back. Okay, and we pull and release. And we're doing that same figure of 8 pattern over the knee. So cross over, band around the bottom and cross over. And this is mostly just to keep all the dressing clean. And the best thing about this stuff is it sticks to itself, so we can just rip and stick. And that's one bandaged knee. What we need to look forward for afterwards is any swelling above or below. And that's it.